So you've already worked with your speech pathologist on selecting the right voice prosthesis and the right stomal attachment for your voice. Now there are things that you can do at home to help further improve your voice. Okay, let's start by occluding your stoma by compressing your HME and just saying ah. That's right. And you want to make sure that you have it fully compressed before you start voicing. If you ever experience the feeling of running out of air when you're speaking in conversation, this exercise can help you work on timing of pausing when you're speaking so that you don't run out of air. So let's practice this sentence. Say the sentence, after I'm done eating dinner, I do the dishes. Practice that and take a pause where it feels natural to pause and get a breath.
After I'm done eating dinner, I do the dishes.
Exactly. So that's a good way to say the sentence without running out of air, and it sounds perfectly natural to pause and take a breath, just like I just paused and took a breath. So putting a lot of stress and tension in your neck and shoulder region can affect voice, whether it's laryngeal voice with a natural larynx or with a TEP in the method that we're speaking here. And laryngectomies often naturally put a lot of stress and tension on the neck and shoulders because of the action of occluding the stoma and applying pressure. But in fact, if you can release some of that pressure in your neck and shoulders and apply less pressure to your stoma, breathe naturally from your lungs, you'll have more airflow and more power to your voice, which will result in improved voice quality and less effort to speak with your TEP. So let's work on that a little bit now. Let's imagine kind of pushing hard, just learning to speak with your TEP and putting a lot of effort and strain here. Push hard on your HME and try to say ah. So you hear how it kind of breaks off because you're putting a lot of tension here. Now let's relax your shoulders and put a little less effort, but make sure you compress the HME completely and just voice from your abdomen. Perfect. And can you hold on to it for a longer time? Perfect. Head position and body position can also affect the voice and the tone and quality of the voice that you produce. So let's try different positions and see if it actually affects your voice and effort. Say ah, and rotate up, and center. Good. So you can see that for you, your easiest, most effortless voice comes in a neutral position.
After I cook, I always do the dishes.
Okay, so what I hear happening now is an air leak. And whenever that happens, it could be one of two things happening that's negatively affecting your voice because you don't have the volume, and you also hear that distracting air leak sound. So whenever you hear that, it's important to check your stomal attachment seal and make sure that air's not leaking out around it. And also check how you're occluding your HME and make sure you're compressing it in the center and not allowing air to escape by compressing one side or the other.
After I cook, I always try to do the dishes.
Okay. So it's important to remember that your esophagus is now the source of your voice, your swallowing tube. So when you're swallowing food or liquid, you're not going to be able to speak right away because your esophagus is trying to move that food. So it's important when you're swallowing or eating that you allow the food to pass before you attempt to speak. Otherwise, your voice quality will be affected.